This video will be about nausea and vomiting of early pregnancy and hyperemesis. Nausea and vomiting are pretty common in pregnancies, and it tends to start in most women immediately the period is missed, and between 4 to 7 weeks, and it can go on till about 16 weeks of pregnancy. Some will stop at 12 weeks. In some women, it carries on to well over 20 weeks. The usual, even though it's erroneously called morning sickness, it's not on. It doesn't only come in the mornings. It can come at any time. But the mild one is that you have the occasional nausea, occasional vomiting, but you're able to eat and keep your food down. You're able to drink and keep most of the fluid down. So in that case, it's not that severe. It's not bothering you too much, and you can manage with it until it eventually stops in some people. But when it becomes very severe, you can't keep anything down, you feel dehydrated, you're passing less urine, feeling dizzy, feeling unwell. That's what we call Hypremesis Gravidarum. So nausea and vomiting is the mild form. When it becomes severe, we have the medical name Hyperemesis. Hyperemesis requires admission into hospital because there's you're dehydrated, there's an electrolyte imbalance. So the patient requires intravenous fluids to replace the ones being lost. She requires electrolytes to compensate for the one that's being lost. And she requires anti-sickness medicine. These medicines are safe and should be given, so that there's no point keeping a woman who is vomiting very severely at home. While nausea and vomiting cannot affect the pregnancy, hyperemesis can affect your pregnancy. It can lead to small for dead babies. It can lead to a lot of other problems with an infant. So that's why it should be aggressively treated. Like I keep telling women, you don't get any prizes for staying at home and bearing vomiting. You want to show you're strong. There's nothing you can do. The vomiting and the hyperemesis is caused by the hormones of pregnancy. There are three main hormones: the HCG, the human gonadotropin, the estrogen, and the progesterone. The estrogen slows down the emptying of the stomach, and the progesterone slows down the motility. These are things that make you feel nauseous. So that when you take anti-sickness drugs, it counters the effect of these hormones. And usually once fluid is given and the drugs are given intravenously in the hospital, within hours, the vomiting should stop. And when the patient feels well rehydrated, she can now go home, but she stays on these drugs, takes them regularly until about 12 weeks of pregnancy, when in most cases, the vomiting will stop. But in a few cases, 10-20%, it carries on beyond 12 weeks. Nothing to be alarmed about. Don't stop your drugs, like I said, trying to show how strong you are. As long as you're having the nausea and vomiting, and the drugs you've been taking have been helpful, continue taking them. You stop intermittently to see how you are. If the vomiting is still persistent, go back and take your medications. There's nothing wrong with that. People always ask, are there any natural products that would be useful in vomiting? Well, there's one that we've come to accept in orthodox medicine. That is ginger. Ginger products are very, very helpful. They help the emptying of the stomach, so they tend to reduce the vomiting and nausea in early pregnancy. It may not be enough on its own, but in combination with mild nausea and vomiting, ginger alone will be helpful. But in severe ones, the hyperemesis, ginger alone may not be, but it's still important to be taking it together with the medications. Any form of ginger, whether it's the ginger drink, or you're chewing the ginger, you're making smoothie out of it, it doesn't really matter. But the ginger products are very helpful, and they're very, very safe for the baby. People ask, will vomiting recur? Unfortunately, it tends to come back. If you've had vomiting in first pregnancy, it might occur, especially the severe one like hyperemesis, which affects about 5 to 10% of patients. Nausea and vomiting is very common, up to 80%, but that's very mild. The severe form, the hyperemesis, can recur. So it's good to know that you have this problem. And once it starts very early, see your doctor, go back on the medications that helped you the last time out and take them. Like I said, you get nothing by trying to show you're strong. You're not. It's not your fault that you're vomiting. It can happen. And there's a tendency for it to come back in the same person. If you've had a severe form of hyperemesis, chances are you might have it again. And if you notice it very early and start treatment very early, you may not need to go into hospital because you are being very proactive. But if you don't do anything, you start vomiting and become dehydrated and then become disoriented and start feeling dizzy, then you have to spend 2 or 3 nights in hospital. So you can avoid that by anticipating that vomiting might occur in this pregnancy. See your doctor early, get your medications, and the medications are essentially vitamin B6, pyridoxine, which is very helpful, and antihistamines, which we use for catarrh and things, they're equally helpful in stopping vomiting, and the antiemetic drugs themselves. The doctor will choose the right combination for you, but please take the drugs. Don't wait for the vomiting to come. Take them regularly. Then you'll be safe of this vomiting. You're able to eat your food. You're able to enjoy early pregnancy yourself. Thank you very much.